Cats are really good at hiding pain or illness because in the wild that makes them more vulnerable to predators. So it can be tricky to know if your cat needs a vet visit. In some cases, though, it's clear that your cat is in distress. Today I want to talk about 5 signs your cat absolutely needs emergency vet care. Hi, I'm a veterinarian. I'm a veterinarian with an emergency and specialty hospital in New Jersey. And these are 5 things that I see quite commonly that when they come in I say, why didn't you come in sooner? Obviously, if they're doing this in your house, that can be really frustrating and really stinky. But more importantly, this can be a sign of a lower urinary tract obstruction in cats. Okay, obviously this can be very scary for you as well. Anytime you see blood coming from your cat, this is definitely concerning. It's a good idea to get your cat to the vet sooner rather than later. Are things like vomiting, diarrhea, lethargy, crying, hiding, and loss of appetite, can all be signs of underlying issues, and if left untreated, can become emergencies. Well, while they may not be emergencies right off the bat, it's a good idea to get your cat to the vet as soon as possible. Blood coming from the gums or nose can be a sign of a toxin ingestion or even a foreign body ingestion. Most of the time, lumps and bumps are benign, especially if they're warm and fluctuant, meaning if you can feel the fluid move around, then it's probably just a simple abscess. Sometimes it's hard to find the source of the bleeding, and it can be difficult to stop the bleeding. So if you see any blood coming from your cat, definitely get them to the vet right away. However, if it does continue to grow, if it continues to increase in size, then it's a good idea to get that checked out by your vet. Some lumps and bumps can be cancerous, but more importantly, if it is cancerous, the sooner you catch it, the better. If you wait too long, then it can spread and become harder to treat. So even though it may not be an emergency, it's a good idea to get any new lumps or bumps checked out by your vet. Blood in the urine can be a sign of a lower urinary tract obstruction or even an infection. Blood in the stool can be a sign of a lot of different things, from inflammatory bowel disease to even cancer. So anytime you see blood coming from anywhere, definitely get your cat to the vet right away. You might think your cat landed okay and is walking away, but more often than not, they can have internal injuries that you can't really see. So even if they're walking around and acting normal, they could have internal bleeding. They could have a pneumothorax or a collapsed lung. They could have injuries to their abdomen, their chest, their pelvis. There's a lot of things that you can't really see on the outside, but on the inside they could be very, very injured. If you did, please hit the subscribe button so you can be notified when I post new videos. I post videos about twice a week, and thank you for watching. Bye-bye. And so if they've fallen from any height, it's always a good idea to bring them into the vet and get checked out. And this is when the urethra gets blocked by either a clump of crystals, a stone, or even hair. And this is extremely painful and can cause a lot of distress for your cat. If left untreated, can be life-threatening because they can become dehydrated and also can lead to kidney failure. So if you see this happening, definitely get your cat to the vet right away. This could look like your cat is making an abnormal noise when they breathe. It could be that their belly is going up and down really fast. Seizures can be caused by many different things, from ingesting something toxic to underlying diseases like liver disease or even kidney disease. They can also be caused by getting a head injury or even a stroke. So there's many different things that can cause seizures in cats. And if your cat is seizing, definitely get them to the vet right away. The longer that they seize, the more likely it is that they can have complications from the seizure. So definitely try to keep them safe while you're transporting them. Make sure you put something soft underneath them so they don't hurt themselves, but get them to the vet as soon as possible. Their flanks, which is this part of their body right here, the side of their ribs, whether it's back here or over here, are going up and down really fast. Cats can go about 2 weeks without food, but only about 2 to 3 days without water before they become severely dehydrated. If your cat has stopped eating and drinking, and you cute and get them to eat or drink anything, definitely get them into a vet right away. This could be a sign of an underlying problem like kidney disease, liver disease, dental pain, or even hyperthyroidism, where their metabolism is too fast. All of these can cause your cat to lose their appetite, and if left untreated, they can become life-threatening. So if you notice your cat hasn't eaten in a few days, hasn't drunk anything in a day, definitely get them to the vet right away. Or you may notice that they're just really trying to breathe. They're kind of like making this effort. And you can see their muscles in their neck really straining when they try to breathe. All of these are signs of respiratory distress, and most of the time, this is an emergency. So I hope this helps you out so you know when to seek emergency care for your kitty. So number 1 is if your cat is having trouble breathing. Now, there are some exceptions where sometimes cats get hairballs, and that can cause some respiratory distress. But if it doesn't resolve quickly, then there's definitely something wrong, and it's causing an obstruction. Or it could be heart failure, which we also see quite commonly. Heart failure causes fluid to build up in the lungs, which then causes difficulty breathing. And so either way, this is very distressing for the cat. And so if you see any of these signs, definitely get to an emergency hospital right away. The next sign your cat needs emergency vet care is if they stop eating and drinking. If your cat starts urinating or defecating outside the litter box, definitely get them to the vet. Another sign that your cat needs emergency care is if they're having a seizure. And another reason is if your cat falls from a height. The last one is if you see blood. Other signs that can be concerning that aren't necessarily emergencies, but if you do notice them, one thing that is rarely an emergency, but can be an emergency sometimes, is a lump or bump. Same goes for wounds. Any new wounds, especially if they're bleeding, need to be seen by a vet right away.